This is a brief lecture about success on the M3 OSCEs, specifically the Step 2 CS style cases. Why are we doing this now? Because your OSCE round 2 is a great practice session. If you start now, you'll have lots of time to plan your test strategy for Step 2 CS. You have plenty of time to practice. The cases we've created for these OSCEs are also your opportunity to practice the type of skills you need to be successful both as a clinician and in the setting of your Step 2 CS. So let's talk about what that test looks like. No, you can't go take it right now and succeed, most likely. How hard do you really have to study? Probably a fair amount, specifically to become familiar with the format of the test. And people actually do fail, and then they have to retake it at great expense. So try and prepare. A little bit of advice from your fellow students that have gone before you. Just remember to take it seriously because it's a pretty significant expense, especially if you have to retake it in another city. And pay close attention to the plan and the differential. Our advice is to take the test early, right after a Step 2 CK, take it seriously, and do practice. So these OSCEs are your opportunity to practice and see how you're doing early in the game, see if you need to add to your practice at this point. Looking at the door chart for a sample Step 2 CS style case, this is basically what you've been seeing leading up into M2 year, and now definitely all of the OSCEs in the M3 year have several cases in this format. Are you writing anything down before you go into the room? So let's talk about when you first get that chief complaint of dysuria, for example. Take 30 seconds and make a plan. What are you going to talk about? What are you going to ask about? Think about what information you need from this patient and what exam findings you'll need to solicit in order to have a successful note. Ideally, write down the patient's name so you don't forget their key vitals, especially a fever or tachycardia, and anything else that you may forget to ask about. Specifically, I recommend that you write down your preliminary differential, your top 3, and then systems not to forget to examine. For example, if you're talking to a patient about abdominal pain, don't forget the renal system. And if your patient has a headache, remember to do a neurologic exam. This is one example of a very detailed algorithm before a student was to enter a room. You don't necessarily need to be this detailed, but you'll find what works for you. I do recommend that you have something that you write down on a regular basis before you enter the room. As a reminder, you have 15 minutes for the encounter. In the doorway, take those 30 seconds we just talked about 7 to 8 minutes for a history, 3 to 5 for a physical, and try and leave 2 to 3 minutes to close and summarize for the patient what you think is going on. You're not allowed to take a watch, so the 5-minute warning is the best that you get. There are clocks in every room. And if you're at the 5-minute warning and you haven't started the physical, now is the time to do so. So this is the door chart we saw earlier. When you come out from this encounter, you will need to enter your history and physical, as well as your differential diagnosis for your top 3 differentials with history and physical exam findings and your diagnostic studies. Consider doing a practice case with a friend to practice your timing on this note, because timing is one of the major reasons why students have poor performance on the Step 2 CS style cases. You only get 10 minutes. When you take the exam Step 2 CS, there are 12 cases, 10 are graded. You have 4 cases in a 30-minute break, 4 cases in a 15-minute break, and the final 4 cases and you're done. It's a very long day. Each case has the 15-minute interview and then a 10-minute note. And if you have extra time during the interview that you've left, you can add that time to the note, but I don't recommend rushing during the interview and physical for that reason. So when you're looking at what you do in those 15 minutes of interview and physical exam, be sure to focus on not only the history and the exam, but also remembering to establish rapport with your patient and summarize for them, offer them some idea of what might be happening next. Common mistakes I see with the interview and physical are asking too many questions, asking too detailed of questions, asking about the wrong types of things, forgetting a key exam maneuver because you can't go back in the room, missing a patient's cues or discomfort about a specific topic, or perhaps their challenge question about how you might counsel them in their certain situation, and forgetting to summarize for the patient. The 10 minutes you have for the note really need to be focused on the differential diagnosis. Yes, you have to write an HPI. Yes, you have to document your physical. But the differential diagnosis, in my estimation, because Step 2 CS does not actually tell us, is where the majority of your points will come. So, common mistakes on the note. If your HPI is perfect and nothing else, you really haven't developed that differential. If you don't document the vitals, especially abnormal vitals, it's as if you never noted them. If your differential only includes a single system, try and branch out from GI to GU, from pulmonary to cardiac. Make sure your differential is broad enough. Try not to select the same diagnosis served differently. Doesn't show that you have a breadth of knowledge. And don't forget to fill in the physical box for the differential diagnosis, because if you are unable to support your diagnosis with both history findings and physical findings, it will be very hard to give you points for that section. So fill out all of those boxes if at all possible. If you're having some specific problems, like your HPI is taking too long to write, you could consider using bullet points, but it does change the way that your writing goes, so it's something you need to practice. If you're running out of time, consider starting the note with your differential. And if you're forgetting to do specific exam maneuvers or ask key things, work on your template and that initial differential that we talked about making. Some of the things they may ask you to do during Step 2 CS include reviewing results with the patient. I would estimate that might be a hemoglobin A1C, a lipid panel, an abnormal creatinine. You might be asked to make decisions or help the patient make decisions about things like quitting smoking. Might have to talk about disease management, like with medications or diet, and any images that the patient may have had done in the past. Some cases don't have a physical. There are phone cases in pediatrics or patients calling in with an ill complaint, and you have to give them advice over the phone. Those won't have a physical. Just follow the directions that you see in the area, in that area on the Step 2 CS template. Timing of your test, try and get it scheduled by May 31st of next year. That sounds really far away, but it's not. Those who schedule later end up taking it very late. So many class of 2020 students couldn't get it in June or July when they waited past very early 2020 or very early this year to schedule. Ideas for studying, you could consider pairing up, solicit the help of your unsuspecting significant other, try practicing with first aid. Step 2 CS first aid has a ton of cases, and they're all formatted in a way that someone else could help you practice by acting as the patient. There are some online resources, and then read everything on the USMLE website. That's where the USMLE website is. Take a look at that. And also there's the first aid. NBME has a little bit of information as well. Think about your clerkship rotations as prep for your OSCE, and consider practicing a write-up while you're writing your patient's note anyway, using that 10-minute time limit and the format. Brainstorm with your classmates or yourself a list of the types of cases and chief complaints that you think you might be tested on for this clerkship, and then come up with your appropriate differentials. You will probably pick some of the topics that will be on your OSCE. And then treat your OSCE like a mini Step 2 CS. These cases are designed to give you an idea of your clinical reasoning skill, just like Step 2 CS. And so for that reason, if you take it seriously, take it as that preliminary test. It'll give you a heads up if you have some extra work to do. a couple of useful links for you. And thanks for watching.